prompt that just appeared. And for anybody just joining, well, I'm going to close the transcript here. I do not like seeing everything that I'm saying getting written out in front of me. So welcome to the VetTriage and Blue Buffalo evening webinar here. What we're going to focus on is really just an overview of not just the veterinary diets that Blue Buffalo offers, but really a little bit of a glimpse behind the curtain into who we are as a company and some of the nutritional principles that we follow. Many of these are actually carried over across the entire brand. So we have a number of sub-brands. When you see a Blue Buffalo diet, that might be part of our Life Protection Formula sub-brand, or Wilderness are two of our most popular tastefuls for cats. And so many of the principles that I'm going to talk about carry through across all of the diets, no matter what Blue Buffalo diet you're holding in your hands. And I think that's very important because that's really what pet owners recognize. On this call, you all understand that you've got to meet pet parents where they are. That's what the VetTriage platform is really all about, is meeting pet owner needs in order to fulfill our goal of providing best care. And we feel that Blue Buffalo really represents the intersection of meeting pet parents where they are on certain nutritional expectations while never compromising on the science. And that goes double for the natural veterinary diet, which is our name for the prescription line of pet foods from Blue Buffalo. So briefly, I just want to introduce myself. I'm Dr. Alex Miller. I manage our team of veterinarians here at Blue Buffalo. I started in the vet world long ago. It's funny how you think you know that number, and then as time goes by, you look back and you say, oh, wow, actually, it's been quite a bit longer than that. Time seems to just keep on flying. I started off as a technician, and it gave me a sense of what things are like truly on the ground. I am a proud Penwee, so I graduated from the University of Pennsylvania, which happens to be where I was born and raised. I worked in GP and emergency for a bit, and then got the lure to come to industry. And honestly, had no idea what a career in industry was. And many veterinarians in industry will tell you this. But I've loved every moment of it, and I'm so glad I made that decision. So I spent some time in pharma, which was very eye-opening and got me to travel around the country and really just understand the regulatory landscape, the customer landscape, and of course the veterinary landscape. I'm fortunate enough to be able to pursue a business or a master's degree in business during that time. And really wanted to spread my wings and spread my horizons and understand the nutrition world more. And that's what brought me over to Blue here. And that's been wonderful as well, to really understand the nutrition landscape. It's so vital that we meet pet parents where they are. I know I keep saying that, but there are so many expectations that people have for themselves with their own nutrition, and that goes that carries over, of course, to their pets as well. And so the ability to deliver on appropriate nutrition and help pet parents fulfill what they're looking for in their pets has been fulfilling in a way that honestly pharma never quite touched. So this has been a lot of fun. I'm also very passionate about well-being for veterinarians. I really want to be a good steward for the profession. So I'm an advisory board member for Not One More Vet, and really I'm just very passionate about anything that's kind of lifting the profession, leaving it in a better state than when I entered it. Got some pictures of me here, pictures of my cat, pictures of my daughter, and I love to bake bread, and I love to drink wine, often together. All right, so I wanted to start with this image right here. And I touched on this a little bit already, but these are just some of the terms. I pulled this from the Chewy website, but these are just some of the terms that a pet parent, when shopping for pet food, might encounter if they were to go on Chewy or walk down the aisle of pet specialty. Terms like dry food, wet food, we all know those. Fresh, prepared, vet diets, of course. Air dry, dehydrated, food toppers, shopping by health condition. Oh, does my pet have a health condition? Maybe I should go down that route. Natural, raw, premium. The point of me showing this is it's a complicated world. And when a pet parent, a pet owner comes to us as veterinarians a little confused and trying to dig in a little bit about what they believe to be proper nutrition, well, no wonder. You really can't blame them based on all the cacophony that exists when you walk down the pet food aisle. And so what I would put forward to you guys today is that Blue Buffalo is uniquely positioned here, because what you got with Blue Buffalo is a brand that pet owners recognize. That value proposition for the pet owner is already built in. They know the brand. In many cases, they fed it, they trust it. And so your challenge as a veterinarian is to believe the science behind it. If we have both of those, pet owner buy-in and veterinarian buy-in, and that's what we're going to spend the next half hour to 45 minutes focusing on, then that's the magic right there. It's just one less thing that in the exam room or in conversations on vet triage, where it won't feel as much like a struggle, like you're sitting in a debate room with Dr. Google, but instead you are able to meet the pet parent where they are, where they have this concept of what appropriate nutrition is, and you can say, Blue Buffalo actually has a diet, whether it's over the counter or therapeutic, that meets your nutritional needs and meets your expectations of what a pet food should be. So this is a little chart that I've created. It's really the features and benefits of the therapeutic diet. But when we look at something, we see something totally different than pet owners do. So that's why I group things into two columns. For veterinarians, what are the things that really matter to us? They're meeting AFCO nutrient profiles, of course. They're AFCO feeding trials, which are these 6-month feeding trials that AFCO kind of dictates how many pets should be in there, and what constitutes an appropriate diet, meaning that the animals haven't deviated much in weight, none of their blood parameters have changed, and so we conduct those on the majority of our diets. Meeting WSAVA guidelines, so WSAVA, World Small Animal Veterinary Association, has a set of criteria that they recommend when selecting a commercial pet food. It's not the end-all be-all, so I think if a pet food company meets these, it doesn't mean they're a great pet food company. You need to know more as a veterinarian. But if they don't, you might want to think twice. Published research and peer-reviewed literature, we'll go over some of that today, formulated by PhD animal nutritionists. So we've got several on staff. They formulate our diets. We consult with veterinary nutritionists. Obviously, my veterinary team is always chiming in on formulation and keeping up to date with industry trends to ensure that we're meeting proper nutrition. Stool and digestibility testing. We need to make sure that what we formulate, what we think is going to happen in an animal, is actually happening. And believe it or not, but pet owners are very fixated on their pet stool. So that's a very important one. And then finally, extensive quality and safety testing. We'll touch on these just very briefly, but it's a whole world. We devote entire teams to making sure that the diets are produced according to specification every single time. It's one thing to say this is a good recipe on paper. We've got to make sure that what comes out of our manufacturing plants is identical time after time, and that's especially important for the therapeutic diets. But pet owners, you tell them all that, and you're leaving them kind of empty. They're looking for something more, and they're looking for something different. So what pet owners see when they pick up a Blue Buffalo natural veterinary diet is they're going to see meat as the first ingredient. They're going to see no meat byproducts. They're going to see natural. And so all our diets are 100% natural. And this is an AFCO regulated term. In the human world, natural doesn't mean very much. But in the pet world, we do have the benefit that AFCO, the American Association of Feed Control Officers, actually dictates what natural means, and our diets meet natural. It essentially means that nothing is derived from artificial sources, no artificial flavors, no artificial colors, no artificial ingredients of any kind, unless that is vital for a diet, for proper nutrition, and it simply cannot be sourced naturally. Otherwise, everything is naturally derived. We are, in fact, the nation's #1 natural pet food. So again, pet owners, they've heard of us. No corn, no wheat, no soy. Those are ingredients that many pet parents are looking to avoid these days, and we like to be able to satisfy that for them. And that's true across all the blue diets, the therapeutic or the over-the-counter. And then finally, high palatability. The proof is in the pudding, as I like to say. When you recommend a Blue Buffalo diet, you can be all but certain that the pet is going to eat it. Best diet's the one they're going to eat, right? I mentioned those WSAVA guidelines. You can take a look at these yourself. They do publish it on their website, but it provides a list of criteria that they feel a veterinarian or a pet owner should look for when choosing a pet food manufacturer. The 2 points I wanted to highlight from here is that safety, efficacy, and compliance. So everything, we'll go over that in just a second, but all our diets go through a 6-point quality guarantee to ensure that what you're getting in the bag is exactly what we promise it will be. And then I mentioned earlier that digestibility and nutrient analyses, again, to ensure that everything is matching what we say it's going to. So this is that 6-point process that I mentioned. It starts with the sourcing. So sourcing means who are we going to receive these ingredients from? No pet food manufacturer has a farm where they're growing their own wheat or growing their own, other ingredients, or a livestock facility where they have their own cows. They're all sourcing it from other places. And so we take that process very, very seriously. We visit the site, we audit them, we ensure that everything they say is going on. It's almost run as if it were a General Mills or a Blue Buffalo facility. But the next is the incoming ingredients. So just because we've chosen a supplier for, say, for chicken, doesn't mean that what we receive in our plants is the chicken that we asked for. We don't take them at their word. We need a certificate of analysis, which means what's in here. Have you done your testing on it? And then we do our own testing on it. And so you can see just a relatively curated list here of all the things that we're analyzing the incoming ingredients for. These include any microbial growth, anything that might be adulterated. Melamine, obviously, was a major issue a while ago. We're analyzing for metal fragments. We want to ensure that what they say is in there is in there. Then we do batch testing and processing testing. And so that's during the actual manufacturing process. We're ensuring that our machinery is up to date and running exactly as it should be. And then we're pulling samples out to ensure that things are meeting specification during the actual manufacturing process. Same goes for packaging. So as we're packaging the food, we're weighing it to ensure proper moisture content. We're using a variety of means to detect metal in there. I know there was a pet food recall on metal. That can happen, probably a broken down machine, but we use X-ray. We use a sieve to make sure that only kibble pieces are falling through and that anything left behind would either be too big or too small. That could be a metal contaminant. And of course, physical appearance. So we're having people kind of look and evaluate the kibble itself. And then finally, finished product. So we do something called positive release, which means we don't say this is good to go unless there's a problem. We assume there's a problem and have to prove that there isn't. So we're doing complete testing on the finished product. We also sit on finished product for a period of around 18 months so that if something happens a month, 2 months, 6 months, a year down the line, we can actually draw from that batch and test against it. These are all very important to ensure that we're meeting the nutritional needs. I think we'll skip this slide. I just wanted to highlight from here the process of actual kibble manufacturing using this extruder here. And so what we do is we've got a pilot plant where we're testing our formulations. We want to ensure that when we scale it up at the wide level, at the mass manufacturing level, where it can reach any pet in the country, that we are able to do so reliably. We start with a process where we're actually testing that in our pilot plant in Minneapolis, which is where we're headquartered. And then once we verify that process is repeatable, that's when we go and produce the diet at scale. The last thing I want to touch on before we dive into the diets themselves is a little bit about claims. And I mentioned that it was a little hard for pet owners to make sense of all the information that's out there. I'll be frank, I think it's hard for veterinarians to make sense of it too, because this is what marketing is. It's designed to incentivize purchase. But sometimes that can mean wording that can potentially be misleading or confusing. And I think that applies for veterinarians as well. We went to vet school. I don't remember learning much I remember a little bit about, claims as far as ingredient inclusion. But when it comes to these claims, I don't remember learning much about it. And I wouldn't be surprised if you don't either. So there's structure function claims, which is essentially, it's a literature-based claim, but it's based around an individual ingredient. So it might be like reduced levels of protein to help limit the formation of bladder stones. It doesn't mean that diet has been tested for that. And so anytime you see a structure function claim, it's usually just based on, we know that this type of diet can do this thing, but it doesn't mean the diet itself has been tested. When you see clinically tested, that does mean the diet has been tested once. So you can say clinically tested if it's been tested. If you say clinically proven, it has to be 2 or more studies that corroborate the same finding. So differentiate those two. 2 studies is still not a ton, but obviously it's better than 1, and it suggests some level of repeatability. Then there's FDA-regulated food claims. And so the FDA does get involved in the regulation of pet food, but not to the level of pharmaceuticals. So no pet food on the market has FDA-regulated drug claims. That would be if you included an actual pharmaceutical agent in the food itself. And so the way that FDA regulates pet food is almost as an unregulated pharmaceutical product. That's right in the wording out of FDA. And an example would be drug-like claims, like you see here, reduces urine pH and hairball claims. So the FDA is sort of, I'm not going to say turning a blind eye to it, but they are recognizing that as long as certain rules are followed, you can make drug-like claims on food as long as they're substantiated without needing full FDA approval that would be necessary for, say, a heartworm prevention or something like that. All right. With that out of the way, I think we'll go ahead and dive into the diets here. So this is the family. As you can see, it's a pretty small family, and we're proud of that. We think that first of all, we've got 5 cat diets and 7 dog diets, 7 canine diets. Remember, this is the veterinary diets exclusively. This is the prescription only vet exclusive diets. But most of them are multi-indication, and we'll cover what those are. In fact, we've estimated that we cover about 95% of indications that are addressable by food. And so if there's something that walks into the exam room and you think to yourself, oh, this animal could use some veterinary nutrition, the vast majority of those, there will be a Blue Buffalo diet that suits them. The other reason that a small portfolio is nice is that it's helpful for training and it's helpful for inventory purposes. It's a philosophical approach, and we take a very different approach than some of the other prescription pet food manufacturers, where they're coming out with new diets all the time, varying things up, 60, 70, 80 products to choose from. Our point of view is that's very much meant to kind of just keep it top of mind. Sometimes the innovation is genuine. Many times it's just kind of tweaking things a little bit here and there. We feel it's very easy to wrap your head around our portfolio, and that's a strength. I'll go through some of the clinical studies that support the diets as well. So we're going to go ahead and start with our GI family. It's available in low fat and regular for canines, and then available regular for cats. So no low fat option for the GI specifically for cats. There's a couple of standout features for GI. What I would say is absolutely the number one. Of course, it's high digestibility, because anytime you're talking about a gut that's in some way compromised, whether it's acute or chronic enteropathy, you don't want that gut to have to work overtime. But really the standout feature is what we call our fiber package, or the different types of fiber ingredients that are found in GI. And so I want to take a second to look at that a little bit more closely. And so what this graph represents is different types of fiber. Along the x-axis, you go from insoluble to soluble. Insoluble, of course, means that when you add it to water, it's just going to sit there. Literally, if you took, say psyllium husk and you added a teaspoon to a glass of water, it would just sink to the bottom. What that does, though, is it adds bulk to the stool. It firms up the stool. Incidentally, insoluble fibers like psyllium husk, or you see flaxseed, tomato pomace kind of more towards the insoluble end, cellulose certainly as well, those are infermentable. It means they just sit there. It means the bacteria that is found in the gut, we all know about the microbiome, they kind of just ignore that. They don't do anything with it. And so that can help certainly with diarrhea. It can help bulk up stools and make them soft, passable, and kind of right in the middle there between a stool that's too hard and a stool that's too soft. So those are very important in enteropathies. But then on the other end, if you follow out on the x-axis and find soluble, and then similarly on the y-axis, fermentability, those are going to be fibers, things like chicory root and apple pomace and cranberry pomace. Those are highly fermentable, and they dissolve in water. That's important because bacteria will actually use those as food. So those are what we consider prebiotics. A prebiotic is an ingredient that actually is, you could think of it as food for the bacteria in the gut. Probiotic means you're giving the bacteria itself, and postbiotic means you're giving the product of bacterial fermentation and putting that in the gut. So these are prebiotics. And what those do is when the bacteria eat those, digest those, use those as a fuel source, they emit short-chain fatty acids as a byproduct, as a waste product, really. It turns out those short-chain fatty acids are actually critical for enterocyte health. And so your soluble fibers are actually helping to heal the colon and heal the intestine faster than if you fed a diet that did not include these. And so which is better? The truth is both are critical. You need a balanced fiber package. So just looking at the amount of fiber, if you're choosing your GI diets by looking at the amount of fiber in there, you're doing your pets a disservice. It's very important that not only that there's a lot of fiber, but that it's balanced. So you're getting the benefit of insoluble as well as soluble fibers. And the GI diet that you see here includes all of those in green. And that's really the benefit of our GI diets. We did a couple of clinical studies to support these diets. The first is an acute diarrhea study. So these were performed in both cats and in dogs, 2 studies for each, so clinically proven here. Remember that terminology. We talk about clinically tested versus clinically proven, or clinically shown versus clinically proven. And what we showed is that for dogs with acute diarrhea, dogs resolved that diarrhea one day, a full 24 hours faster when being fed Blue GI. Compared to a commercial diet, a commercially available diet. And then for cats, that was actually 1.6 days. So this is a real standout for us. Absolutely, GI is used all the time. It's incredibly palatable, highly digestible, and that resolution of acute diarrhea is pretty noticeable. We also did a study in cats for chronic enteropathy. Technically speaking, these cats did not have IBD, and the reason I say that is that they were not scoped. This was diagnosed via scoping and with histology. But otherwise, these were cats that were showing chronic signs of GI disease. And what we showed is that when maintained on a commercial diet, only about 30% of their stools were within the desired range, kind of that ideal range of not too soft, not too hard, the Goldilocks zone of stool. But when fed the Blue NBD GI diet, about half the cats returned to normal stool function, or I should say, the average stool was within that desired range. So really impressive results. A number of universities around the country use GI Blue, and this is the reason why, because it's so helpful in chronic enteropathy. And a lot of focus now has been on cats with chronic GI disease, and how veterinarians will sometimes look over the diet. They won't necessarily take the diet into account nearly as strongly as they should, and will keep tweaking, flagyl doses or work in other antibiotics or other supplements, but not necessarily look at the diet as a source for getting that under control. The other thing I wanted to mention about our GI diet is this logo that you'll recognize here. I'll go over this shortly at the end, but StoneGuard is our proprietary name for struvite prevention, struvite dissolution, and oxalate prevention. And so I mentioned earlier that these were multi-indication diets, and most of our diets are labeled for both struvite prevention and dissolution and oxalate prevention. And there's a chart at the end that'll help you with that. And GI certainly fits the case there. GI low fat is very similar. It just meets AFCO requirements for less than 10% fat on a dry matter basis. And that's obviously going to be most useful in your fat responsive diseases or low fat responsive diseases. Pancreatitis comes to mind, hypertriglyceridemia, and any other disease you feel would respond well to a low GI or a low fat diet. Okay, we're going to go ahead and move on to our derm portfolio or dermatology portfolio. So next up is HF. HF stands for hydrolyzed for food intolerance. As you can see, we offer cans for cats and dogs, as well as a dry diet. And this is by far our number one seller. It is a real standout diet, and I'll tell you why in just a second. And so the principal ingredient in HF is hydrolyzed salmon. And that is unique in the hydrolyzed food world. So you may be aware the principle behind hydrolyzing a diet is that you're taking that protein source and you're breaking that down into smaller pieces by chemical means, so small, kind of these very, very long peptides, that the body is unable to recognize those as antigens. It's commonly believed that 10,000 Daltons is the threshold where the immune cells start to recognize these as potential antigens. So the goal with any hydrolyzed diet is to ensure those proteins are less than 10,000. The average molecular weight of our diet of the salmon ingredient in HF is 2,000 Daltons. So you got quite a buffer there. But it is kind of a bell curve. It's a standard distribution. So there are occasional proteins that are larger than 10,000. I will admit that of HF, and that is true of any hydrolyzed diet. Occasionally larger proteins slip through. The benefit of a salmon-based hydrolyzed diet is that salmon is way lower on that list of potential allergens compared to the protein sources that you see in hydrolyzed diets, which are chicken and soy. So a lot of dermatologists feel extremely comfortable recommending HF first because of that extra kind of padding, if you will, or safety net, where salmon is the only animal protein in the diet, and it's all hydrolyzed. Of course, salmon also comes with other benefits. It's seafood, right? So it's really high in omega-3s, which are very important for anti-inflammatory purposes, and that's really going to help with skin healing. It also, we've got the same fiber package. So I talked pretty lengthily in GI about the variety of different fiber sources that we bring in. HF carries all those same fiber sources with it. So the truth is, many people are turning to, and this doesn't just go for blue, many people are turning to hydrolyzed diets for the treatment of GI disease, even if it's not believed to be a food allergy or an adverse food event. And that's simply because the fiber package in those can be extremely helpful and in avoiding some of that immunogenicity that we see in the gut itself. As far as guaranteeing, we get this question a lot. How can you say that what's in there is really in there? There's a couple of different things we do. First of all, when we're producing our allergy diets, we do a complete clean out of the manufacturing facility, which of course means your standard soap and disinfectants. But then we also do a burnout, which means extremely high temperatures to kill anything that's in there and basically eradicate any food debris that may be left behind. That's a good step, and I know other companies do this as well, so there's no differentiation there. But we don't necessarily feel that's enough because, I cleaned my floor 10 times, and then I get on my knees and I look really closely. Still stuff there. I consider myself a pretty good sweeper, pretty good mopper, but it's possible to leave something behind. So what we've added for HF is ELISA. And so we're ELISA testing for chicken, for beef, for soy, and for egg in these diets. We want to make sure that the only thing in there is salmon. And I'll be honest, we get hits once in a while. And that's a good thing because it means that we're doing the adequate testing to ensure that if there's something that's not going to deliver on the results we promise, we toss the batch and we start over. And then again, you see that struvite labeling on there. We did do a head-to-head. We worked with Dermatology for Animals on this study, which was a head-to-head with Ultimino. So the leading poultry feather, as you probably all know, that's the source of a protein in Ultimino. What we were able to show in this study over an 8-week trial period is that the resolution of clinical signs, meaning itching and hot spots and things like that, was identical. There was no statistical difference between the performance of Ultimino and HF. What we found, interestingly enough, is that there were actually fewer adverse events during the study with HF. There were only 7 adverse events in the group compared to 16 with Ultimino. Now, I'm not here to say that Ultimino is a bad diet. I think it's a fine diet, but it is interesting that the number of adverse events was more than double. So this doesn't count as itching. This counts as things like vomiting, diarrhea, and things in that category. All right, I'm going to move on to the other dermatological diet, which is NP. NP stands for novel protein. And again, currently we only have the dry available. We do hope to have the canned version back before long. But the interesting thing about NP, with HF being salmon-based and that being the leader, we thought, hey, we've got to do something similar with NP. The protein source in NP is alligator. And so we refer to this as truly a novel ingredient. So you probably know I talked about hydrolyzed diets and how those can help with suspected food allergies. A novel protein is simply giving the body something it's never seen before with the hopes that there won't be an allergic reaction. The problem with that is it's a bit of an arms race. A novel ingredient is a novel ingredient until it isn't anymore. And so if you look at some of these traditional novel proteins, things like duck and venison, egg, they're not really novel anymore. Now you can walk down the supermarket aisle and find these in all sorts of ingredients. And so there's nothing wrong with those ingredients, but most dogs have seen these at some point in their life at this point. So you've really just got to keep on moving and not run out of proteins. Alligator, for sure, is not a common protein found in commercial pet foods. And that's why it still works incredibly well. And we strongly believe that there's no cross-reactivity with any other, with it like chicken or anything like that. I know everybody says that alligator tastes like chicken, but in chemically speaking, it's probably closer to a fish. And a nice thing about using alligator as a novel protein source is, like salmon, because it's more like a fish, they live in the water, of course, very high in omega-3s. And that's really helpful for reducing that inflammatory reaction that's part of any type of allergy, whether it's atopy or whether it's a food allergy. NP is also formulated for all life stages. And so this is pretty nice because you can start this in a puppy. Remember that allergic skin disease due to food allergy can start pretty young. There are definitely animals 6 months and younger. And so one of the challenges as veterinarians is when we see a younger animal that's still growing, that needs to be on a therapeutic diet, our options become more limited because many of these are not complete and balanced for growth. GI is complete and balanced for growth on the canine side, and then NP is as well. So really nice, kind of multi-indication and the ability to use these in as many patients as possible. We do ELISA on the NP diets, just like we do on the HF. That's going to be for egg, beef, and then we're using PCR, which is a little bit more of a sensitive technology to actually look for chicken in the diet as well. We wanted to ensure that there was no chicken just because of the similarity with alligator. And so we're doing both PCR and ELISA on these diets. And then again, the struvite, the stone guard claim is present on NP as well. So your struvite prevention and dissolution, and then oxalate prevention. Keep on going through here. We've got a line of kidney diets for dogs. It's standalone kidney, so KS stands for kidney support, now available in cans, or cans have just come back in stock. We're incredibly proud of this. It was always a really palatable option for dogs, and it was a little thorn in our side to not have that available, but we're incredibly proud to have brought that back, available in a dry as well. And then our feline version is available with mobility support, so K plus M, kidney plus mobility. Most people on this call, I can imagine, understand how kidney disease is managed nutritionally. Essentially, you're trying to provide a moderate protein restriction. These are not extremely protein restrictive. We don't want that. Many times these animals don't want to eat. We want the diets to be palatable. We also want to maintain muscle mass. But more importantly than the amount of protein is the quality of the protein. We want to make sure there's no nitrogenous waste. Those damaged kidneys are going to be leaking protein, any extra protein. So if we just cut back on protein, but we provide a pretty poor protein source, those unused amino acids are going to be are going to go out of the dog with the urine, and those can actually be nephrotoxic. So it's very important that we provide high quality protein. These diets are approved for all iris stages, and then in the case of the feline side, obviously we've added mobility support. I'll touch more on mobility a little later on, but we're talking about things like glucosamine, chondroitin, very typical joint supportive ingredients, and then vitamin C and E as well, which can be really helpful in stopping that inflammatory cascade. For these diets, of course, we do not offer struvite prevention. You would not want to. That's one of the goals of kidney support, but they do have oxalate prevention on there. So the Stone Guard label is still utilized. But remember, those are just for oxalate in the case of K plus M and NKS. One thing I want to touch on with K plus M And we presented this information at the American Academy of Veterinary Nutrition symposium in 2020. So that was virtual, obviously, because we were in the middle of COVID. Was the use of K plus M as a senior diet. So I have an 8-year-old, now she's 9, Kitty, who's in perfect renal health as far as we can tell. SDMA is normal, UA was normal, but I asked one of my coworkers, what should I feed? And based on what we already suspected, but then information that came out of the study, K plus M is what she now eats. And so what we did is a study of 12 senior cats, and we wanted to be able to show that over a period of 6 months, we were able to maintain lean muscle mass in these cats. That was important if it's being fed as a senior diet, but it was also important if we're feeding it to renal patients, because those animals obviously are incredibly sensitive to, we all know those kidney cats where they just feel like a walking skeleton. And so the nice thing about this study is it demonstrated that the amount of protein and the quality of the protein in K plus M provided enough nutrition that these animals were able to maintain their lean muscle mass. And we did so by what's called a DEXA scan, which is essentially a kind of a 3D scan of the animal that demonstrates, much better than just kind of a rough estimate using a chart. We're able to show how much of that weight is actually from bone mass, from lean muscle mass, and from fat. I also wanted to mention these diets are suitable for cardiac disease. We didn't want to muddy the label and put that on the front as well. But when we look at the types of things we're looking for in heart health, we're often talking about the addition of extra taurine. We're talking about mild sodium restriction, never severe sodium restriction, because that will lead to sodium retention, and then high levels of omega-3s. And so these diets actually meet the criteria for cardiac diets. And so that's one of those situations I mentioned where, hey, it might not be right on the label, but these really are multi-indication. And if an animal is in need of a nutritional, needs certain nutrition for its condition, chances are there's an NVD diet that will fit the bill. I'm going to move on to weight plus urinary. To sum it up, the urinary aspect of these diets is really what we've seen all along. It's that struvite and oxalate prevention and then struvite dissolution claim that we've seen all throughout. And those are supported by RSS studies, where we're actually analyzing the diet's metabolites themselves to show that what the dissolvability of struvite and oxalate is going to be in the urine produced by these animals. But I do want to focus on the weight aspect for a bit. Weight's an interesting one. I've been pretty surprised as I've come into the nutrition world that we shy away from weight conversations. And I will admit that in my time in practice, I certainly discussed it less and less as time went on. It just felt like a little bit of a battle with pet owners. But the truth is, nutrition can be so critical. If we can bring these animals back to normal weight, this is sort of like preaching to the converted. It's common sense, but not common practice. We can stave off so many nutritional diseases. Shadi, I see you nodding as a surgeon. You probably know that getting patients back to a healthy weight is critical for lifelong happiness and quality of life. And so our weight diet is really a metabolically motivated weight loss that occurs. So some of the things that are in both the cat and dog versions of these diets that promote weight loss are going to be a mixed fiber package to support satiety. That basically means that the animals can eat quite a bit of it and feel full. But that in and of itself, calorie restriction is not going to lead to healthy weight loss. What we do additionally is we add L-carnitine and betaine. And what these two ingredients do is they help maintain lean muscle mass. So just as I mentioned with kidney plus mobility for cats, our weight diets have been clinically shown to maintain lean muscle mass while the animal is losing weight, and then maintain that weight as well. So I want to take just a second to go over that data. So in our clinical trials, we showed that dogs lost on average, and this was over a 2-month period, so about an 8-week period, about 17% of their body weight. And cats lost about 12.5% of their body weight, which is fantastic. And we've confirmed that this can be done with animals just feeding the diet, or with pet owners feeding the diet as is. So really no special instructions being provided. Just feed your animal as you normally would. But those numbers aren't enough, because most of that weight loss comes from muscle mass. the animal is not healthy. They're what I like to call a marshmallow on a stick. They're fat, covering their skeleton, and very little muscle mass to speak of. So what we were able to show is that the fat loss was 37.5% in that same period in dogs, and just a little lower at 34.7% in cats. And in the meantime, their lean muscle mass stayed completely flat. And so they were able to maintain no change in their muscle mass while they lost only fat. And that's because of the metabolically derived ingredients in there that are actually promoting fat burning. We also offer a weight plus mobility in dogs. So that's the same weight loss functionality that you just saw in weight plus urinary, but instead of being paired with a urine function, it's being paired with mobility support. That mobility support comes from, I mentioned this a little bit earlier with the cats, from additional EPA and DHA, very high levels, bordering on what you might find from a joint supplement. And then also antioxidant-rich vitamin E. We know that vitamin C also plays a role in limiting some of that oxidative stress from that ongoing inflammatory process of mobility. And then lots of supplemental sources for omega-3s. Those are going to be things like salmon, fish oil that comes from shrimp meal, and flax seeds as well. Another multifunction claim that we are actually in the midst of pursuing right now is diabetic claims. And so both, so W plus U on the feline side, dry, and then W plus U canned and GI canned actually both meet the nutritional criteria for diabetic diets. When you look at cats, what they're recommending is one of two options. A low carb, high protein option, and that carb level needs to be less than 20%. Remember that cats are obligate carnivores, which means they don't really process those carbs super well. And when you feed a cat carbohydrates, there's nothing wrong with including carbohydrate sources for cats. But for cats with diabetes, it's going to lead to a spike in blood sugar pretty quickly, and they're just not processing those carbs correctly. It actually could be potentially pancreatic toxic as well, furthering some of the damage to that pancreas and further limiting the release of insulin from that overstressed pancreas. So that's why we try to avoid carbs in cats with diabetes. So that's one option. The other is a moderate carb, so less than 40%, a little different than the less than 20 we just talked about, but really high on fiber. And that fiber is going to slow down the passage of ingredients through the intestinal tract, slow down the absorption of sugars, and make it so that they have a more balanced insulin levels, and in kind, balanced leptin levels. So this can help with appetite as well. And then finally, moving on to dogs, obviously dogs get a totally different type of diabetes. They get type 1 diabetes, or what's commonly called insulin dependent. And so the approach for them is going to be very different. For dogs, what we really want is a high fiber diet. And that fiber plays a critical role in ensuring that passage through the gut is slower. We think that maybe even by creating that gel-like substrate that many soluble fibers produce, we can actually sequester some of that, some of the carbohydrates within the diet, and allow for no absorption or slower absorption, again, to balance blood sugar levels and ensure that we're not shocking the dogs who obviously can't control their own blood sugar. All right, so that was the family. I want to highlight the StoneGuard labeling again, or branding. And so this chart, which we can share and we have available in our materials, really highlights which of our diets are suitable for which condition, which, for struvite dissolution prevention, and then for calcium oxalate prevention. So it's a handy chart that helps you navigate a little bit better. But again, I'll highlight, rather than navigating pages and pages of different diet options, it's a very curated list here and pretty easy to wrap your head around. And that's why we feel it's such a good clinical companion for veterinarians. The last thing I want to touch on before we wrap up is our online portal for ordering. It's kind of a 3-in-1. So our online portal is called Blue at Home. And if I'm not mistaken, VetTriage is in the midst of trying to get signed up for this portal, so we're nearly there, and we're going to have this ready to demonstrate for you all very soon. But it does three different things. The first thing it does here on the left is it allows you to order product for in-clinic use. Now, this may not be super relevant as far as VetTriage is concerned, but if you work at local practices and you're at all interested in having this in place, this would allow you to order product for in-clinic use, and that comes at a 30% discount off of list price, which just happens to be the same discount that Blue employees get. The middle function right there allows pet owners to order products through Blue. So it's sort of, think of it as a competitor. You know, these days it's so hard to compete with the Chewies of the world, the Amazons of the world. And so what this portal allows is a curated way for pet owners to go on, buy their Blue diets. There's a little search window in the beginning where they look for your clinic. They look for VetTriage or whatever clinic you happen to be working at. And just by putting that information there, if they order a prescription diet, one of the veterinary diets we just went over, it will prompt the email administrator at your hospital to get an approval. They'll check the approval, and that'll get shipped right to the pet owner. If they order an over-the-counter diet, obviously there's no need for approval. But either way, 15% of the purchase price comes back to the clinic as a rebate check. And that comes on a monthly basis. So it's a little bit of profit sharing, in a way, I think, for veterinary medicine to kind of take back some of those profits that we've lost going to online e-com sources. The final option is ordering for yourselves. We are strong believers in feeding you all or feeding your pets. The reason is twofold. First of all, we're all in it together, right? And so anything we can do to help cut costs, we like to. And again, that's a 30% discount for you, same as Blue Buffalo employees get. But the second is that, like I said earlier, the proof's in the pudding. And so it's one thing to hear me talk about all these benefits and features today, and they sound pretty good on paper. But are you going to feel comfortable recommending that for your customers if you don't believe in it? And so that's where you get a chance to test out the palatability, test out the functionality yourselves. I hope you don't have a pet who needs a therapeutic diet, but we're veterinarians. Chances are, we all get the lemons. So if you do have any pets that need NVD, you can order through that. But we offer all our diets through that program as well. So you can try any of our over-the-counter diets as well. So again, that's the family. At this point, I'd like to thank VetTriage. Thank you, Shadi, for having us on the call today. We're really excited about this partnership. We think you guys have an awesome platform, and we think that a Blue diet goes hand in hand with what pet owners are looking for. We hope you feel the same.
Thank you very much for your time and a great presentation. Could I ask some questions if you don't mind?
Absolutely. Yeah, I actually finished a little earlier than anticipated. I could talk all day, so I'm impressed that I managed to squeeze that in. But no, now is the time for you or any of the guests to fire away as far as questions are concerned.
Sure. Do any of the guests want to ask questions? I don't know who's here, but otherwise I have a few questions I'll ask. Do you know whenever we switch a dog or a cat to a new diet, everyday thing does that replace it by 25% each day, so that by day 4, day 5, you're at 100% the new diet. Is that still the recommendation in general, and especially when it comes to animals that have GI, that you're treating for GI issues with diets? Is that transition, that period of time still makes sense, replacing it 25%, or is there like a new rule, a new thing that people are doing?
Yeah, that's pretty much still in place. I'm not aware of any, advancements in terms of understanding that process better. Every animal is a little different. So our recommendation is actually a bit more conservative. We recommend 10 to 14 days. I think that's really just so that we can capture those few animals that would actually need that amount of time. The truth is, I think pet owners all the time don't necessarily know that. And they'll feed, they'll just go cold turkey and feed the next diet. And they'll say, oh, well, he did fine. In which case we say, well, great, then your dog is one of those that just has a little bit of an iron stomach. But we know some animals have sensitive stomachs, so that's really what it's designed to mitigate. It's also in the event that the animal has an adverse food reaction to it. And so obviously some of those are dose dependent. And so I would much rather my cat, for instance, we find that out while she's receiving 25% of the diet, rather than she ate a giant bowl of it and then it all comes out the other end and she's got, sequela for weeks at a time. Most animals will show signs of an adverse food event within a couple of days to a week.
Yeah.
It's sort of, I'm not going to say it's a fallacy, but we talk about that it can take quite a while, and some animals may, but for the majority of animals, they're going to show that food allergy really quickly, and they're going to show resolution when you discontinue it very quickly as well.
Gotcha. And then in regard to the fish oil, I think you mentioned omega-3s. Is the 3 to 6 ratio still a factor when you're incorporating omegas into your diet, or is it that omega-3 is just the better and that's what you're focusing on?
No, it's still a ratio. I mentioned omega-3s because they're a little harder to source, but kind of slightly pricier. Like you can get omega-6s from canola oil. Omega-3s, you have to look for some more isolated sources. But no, the ratio hasn't really changed. So it's all about the ratio to ensure a proper balance still.
Gotcha. Okay, cool. And then in regards to the hydrolyzed protein diet, if you ignore like things like palatability or cost or whatever, would it be the lazy way out to just put pets on hydrolyzed protein instead of trying novel protein diets and seeing, through trial and error over weeks, what happens?
Absolutely. Yeah. I mean, I would say palatability is a big part of it too, but yeah, all things being equal, I would say without a doubt, hydrolyzed is the gold standard, just because it's not that arms race. There's really no way for the immune system to evade that. If it's going to work, it's going to work. And if it doesn't, it won't. So why not start with your so-called big guns? I don't like that term because it suggests there's a negative component to it. The only negative component to it is that the hydrolyzation process is expensive in and of itself. And salmon is a more expensive ingredient than, say, poultry feathers or something like that. And so it is. We're actually cost comparative. So we take less of a profit on that diet because we wanted to price it competitively. But it is our most expensive diet. And that's just based on, trying to compensate for the costs of what go into that diet. But you're absolutely right. If the pet owner and the dog are satisfied with the outcome of being on that diet, there's really no reason to work your way down. So I think the reason we offer NP is for a different option. But then also if the price, if they're looking for something a little bit more affordable, they might work their way down to NP. And then once you go from there, we actually have a science adjacent or a science facing over the counter brand called True Solutions, which has a skin diet. And then there's also a sub brand called Basics, and Basics is a limited ingredient diet as well. It just doesn't go through the rigorous testing and guarantee that our therapeutic diets do. That's where some of the increased costs come from. But great question, and you're absolutely right. It is the gold standard to go with hydrolyzed.
And then final thought that I had, or final question was, you mentioned maintaining muscle mass with renal patients, but then with cardiac, you mentioned that the omegas help with cardiac health and all that stuff. What about cardiac cachexia? Is that managed? Is the goal still the same for those animals who are losing muscle mass from chronic cardiac disease? Can you treat them like a renal patient, I guess, with the diets, or you think it's a different pathogenesis, and maybe that's just beyond the scope of what that diet's supposed to do?
Yeah, I would say that with that diet specifically, we haven't evaluated whether it can maintain cardiac muscle mass. I'm not aware of a diet that has looked at that. If you are, let me know, or anybody else on the call. It is a goal, of course, of nutritional treatment. I think a lot of that comes from just proper nutrition, right? That you're getting enough calories and you're delivering a high quality protein. But no, that's not a claim that we would feel comfortable making, where we would say this maintains the muscle mass of the cardiomyocytes or anything of that nature.
Sure, and it may just incidentally be a benefit anyway without knowing it, before you performing further research. So it's cool. Yeah, no, that's all I had. Thank you for entertaining my questions.
Oh, of course. No, that was a great lineup of questions. I appreciate them. Anyone else on the call? Any other questions? Thoughts, concerns?
I have one question.
Yes.
Yes. So, hi, I'm Dr. Anna. Like, I joined a little bit later, but I was scrolling through the presentation, and there's one thing that interested me. Like, your main protein is meat, but the three main proteins that cause like all and chicken.
I lost your audio.
Meat and pork.
Yeah, I lost your audio. Did anyone? I'm sorry. Did
You
anybody
got
else?
that? Are you?
Is anybody else losing her audio apart from me, or am I the one?
I heard chicken and pork.
Yeah, she's breaking out.
Okay.
Okay, let me get inside because I'm on.
No, it's okay. And while you're doing that, I'm going to repeat the question. No need to come back on if I state your question correctly. If I heard you right, you were saying that the first ingredient is animal protein in all our diets, absolutely. But that animal proteins top the list of potential antigens or allergenic antigens in animals with allergies.
Yes.
Yes.
So
yes.
I read that meat is the main one on your diet. So my question will be: are you interested in trying Nova proteins?
Novel proteins meaning non-animal sources? Are you talking about things like pea protein?
Novel proteins. We're meaning like venison and other animal products that are not the ones currently used.
Gotcha. Yeah. So we offer. You're right that the majority of our diets. This is going to be over the counter, and then on the therapeutic diets, which we discussed tonight. Include proteins that could be antigenic, chicken being amongst those. We don't beef, certainly fish to a lesser extent. We do have 2 derm diets, so you may have come on just afterwards. We're going to share the recording, and so you'll be able to go back and listen to that part more in detail.
I know the hydrolyzed diets, and I know that because I was hearing that whenever Shadi came in talking. But apart from the hydrolyzed, I have found in clinic that usually giving novel proteins like venison and bison and stuff like that really helps with the allergies, food allergies.
Yeah.
So
yeah.
I was
so
wondering.
We offer. I'm sorry to interrupt you there. We offer a novel protein which includes alligator. Our position on that is that alligator is truly novel. I'm glad that you're having success with the novel proteins that you mentioned. Most of the nutritionists and dermatologists that I've spoken to feel those that really aren't novel proteins anymore. At this point, bison and venison are so genetically linked to beef that, and then mixed into diets. Like if you can go to a supermarket and buy a diet that contains venison, that's not a novel protein anymore. Because between different diets that pet owners switch all the time, plus treat options and toppers and all these different things they're doing, the likelihood that animal has seen venison at some point in his life is very, very high. That combined with the fact that they're just not all that different from some of the other proteins that they've received mean that many are not considering those novel anymore. So if they're working for you, great. I'm not here to argue that they're not working. But our position, so we offer a novel protein in alligator, and we think a truly novel protein that an animal has never seen before is the way to go.
So that was actually my question. If you had another, what we'll call novel protein, so that you answered my question right there.
Oh, good. Okay, perfect. Glad I could do that. Yep, no problem.
So
Thank you for the question.
Yeah.
Anything else? All right. Well, with that, then I think we'll end the call. Shadi, I'll turn it over to you for any closing remarks, or we can just end it here.
No, thank you. I appreciate the work that you put into this. For you and your entire team, you guys obviously put a lot of research into your products, and we're very happy to partner with you folks as well. I'd love to share the recording of this when you have it available to the rest of the team. And if there are any other questions they have from the playback, I'll be happy to forward them to you guys as well. But otherwise, if there's anything we can do from here on out to help further the relationship, whatever ideas you may have, we're an open book and very versatile. So please keep us in the loop.
Will do. Yeah, again, really appreciate the opportunity, and thanks so much. Look forward to next steps.
Thank you so much. Thank you.
All right. Thank you, everybody. Have a great night.